Assalamu alaikum. Sickle cell anemia or sickle cell disease. So case presentation, Jamie is an Afro-Caribbean child, looks well, small for his age. I would like to plot him in central chart. He is ectoric pain and having a cholecystectomy scar. So my differential diagnosis is a case of hemolytic anemia, most probably sickle cell disease. Thalassemia, however, there is no hepatosplenomegaly is found, and it may be hereditary spherocytosis, but there is no, although there is jaundice and pallor, but there is no spleen is palpable. And so for investigation of sickle cell disease, so diagnostic investigation, full blood count here with RBC indexes. Here there may be hemolytic features with anemia with reticulocytosis. PBF, there is sickle cell is present, and hemoglobin electrophoresis, there is hemoglobin S, hemoglobin F, hemoglobin A2, hemoglobin A absent. And in imaging MRI of brain, chest X-ray for acute chest syndrome, and ultrasonography for organomegaly, and X-ray, and organ function test, liver function test, renal function test, fundoscopy examination. And here there is, if the child is the risk for transcranial Doppler after the age of 2 years, it shows if there is clot in the blood vessel, and if the flow rate is more than 200 ml per second, is indication for exchange transfusion. And treatment of sickle cell disease, multidisciplinary team consulted pediatric hematologist, ophthalmologist, orthopedics, and neurologist, genetist, liaise with school, open access setup, follow up and advice. And folic acid supplementation and supplementation of hydroxyurea, and management of acute crisis, and keep the and treatment of autosplenectomy, lifelong penicillin prophylaxis, extra vaccination, and genetic counseling, bone marrow transplantation is the definitive management. And I will give him advice for good hydration, keep warm, avoid overcrowding areas, avoid high altitude, check tummy if less than 5 years for sequestration crisis. And now some theoretical discussion regarding sickle cell disease. Where is the defect? It is a qualitative defect for valine for glutamic acid, and there is some types of crisis in sickle cell anemia. This is splenic sequestration crisis, veno-occlusive crisis, and aplastic crisis. Aplastic crisis following parvovirus infection, and splenic sequestration crisis, this needs blood transfusion. And veno-occlusive crisis, veno-occlusive crisis, acute painful crisis. So they may come, the presentation may be abdominal pain, bone pain, dactylitis, which is triggered by cold exposure. And here the management will admission, keep the child warm, antibiotics, and maintenance of the hydration. And acute chest syndrome, here chest pain, fever, infection, and in chest X-ray we can find that there is features of lung infection or infarction. And management, admission, oxygen inhalation, analgesia, keep warm, hydration, antibiotic, exchange transfusion, meditate. And functional is splenia, management is full immunization, extra vaccine, prophylaxis, penicillin for lifelong. And stroke needs urgent transfusion, priapism, and vascular necrosis. And role of hydroxyurea in case of sickle cell anemia, it increased the hemoglobin F level, and it reduced the episode of crisis and decreased hospital admission, reduced acute chest syndrome and stroke. And main other clinical complication: chronic anemia, jaundice, aplastic crisis, recurrent acute painful crisis, splenic sequestration, acute chest syndrome, stroke. And here it is written in the MACBT that annual screening of the transcranial Doppler is needed if this is high risk case, and most frequent transfusion to keep the hemoglobin is less than 30%. And indication of exchange transfusion in case of sickle cell, this is the acute chest syndrome, and stroke and priapism at head, chest and lower part. There's 3 indication, and indication for blood transfusion: sequestration crisis, aplastic crisis. And causes of splenomegaly in case of sickle cell anemia: if the age is less than 5 years, sequestration crisis, sickle thalassemia, portal hypertension. Causes of abdominal pain in case of sickle cell anemia: occlusive crisis, gallstone, lobar pneumonia, sequestration crisis, liver affection, NSAID. Thank you.